Assalamu alaikum. Today we will discuss about the treatments of the schizophrenia, how we can treat the schizophrenic patients, how we can minimize the psychosis, or how we can deal, and what are the therapies we can apply for the schizophrenic patient. For example, for the treatments of the schizophrenia, we can apply cognitive behavior therapy, antipsychotic drugs, ECT, electroconvulsive therapy, role playing, role rehearsal, and systematic desensitization, and the other techniques we can apply for the schizophrenic patient. And now I will tell you about in details everything and the every aspects for treating the schizophrenia. First of all, we can say that we can apply antipsychotic medicine. Are there in many cases there are a specific hospital that called state hospital. State hospital means public mental hospital in the United States run by the individual state. In these hospitals we can treat, and the separate hospital only treat the psychosis patient or any other psychological disorders can be dealt. Next is our malaria therapy. We can apply malaria therapy. What is malaria therapy? We can say a holistic approach to institutionalized treatment based on the promise that institution can help the patient to recover by creating a climate that promotes self-respect, responsible behavior, and a meaningful activity. We can say that malaria therapy, a therapy of the humanistic approach that we can say institution do the help. They are different institute, and total institute do the help of the patients. When the attendant of the patients ask or the affiliate with these institution specific institution do the help of the patient for recover the schizophrenic patient and others. We can apply behavior therapy, and the behavior therapy we can apply token economy technique. The token economy technique is the technique of the behavior therapy. We give the token to the clients, we give the token to the psychosis patients, we give the token to the schizophrenic patients. And why we give token? We will give token if we see any good behavior. We understand the patient that if you do the good behavior, we say the schizophrenic patient, if you show the good behavior, then we will give you token, and these token you can take benefits for the better management. We can also apply the antipsychotic, that's the clear with the drugs for the antipsychosis. Antipsychosis means the drugs that can reduce the psychosis problem. And next, the neuroleptic drugs is the clear the drugs that will use for the neuroleptic problem. Neuroleptic, there are many neurological the neuroleptic problem. We can apply these drugs to the patients of the schizophrenic. And we can also apply extra pyramidal effects. What is the extra pyramidal effects? We can say unwanted movements. Is that clear with the name? Unwanted movements are the movements that is the totally bizarre, totally stupid activity, and up so on. And we check the pyramidal effect. And also we can apply sedative dyskinesia. What is sedative dyskinesia? We can apply extra pyramidal effects involving involuntary movement that some patients have after they have taken conventional antipsychotic drugs for the extended time. We give the antipsychotic medicine for the betterment, or for the long time betterment of a patient. We can apply. And next is agroneurolocytosis. What is agroneurolocytosis? We can say life-threatening drop. Life-threatening drop in the white blood cell. In the life-threatening drop means we can say can say that the drop that can totally disturb the life in the white blood cells. If these drops will create in the white blood cell, it can be possible our patient can be death in specific condition. If these condition will be involved, then this condition will call agroneurolocytosis. This condition is sometimes produced by the typical antipsychotic drugs dopamine or the clozapine. We can apply clozapine drugs that can be proved the life-threatening drugs. and also we can apply in the different other techniques. For example, we can apply social therapy. In the social therapy we will give the social skills and understand about the social and the society, how you can deal, how you can deal the society and how you live in the society. That will all in the social therapy we can apply. Communicate approach, how you will do communicate in the society, and what are the techniques of communication in the society, what are the better for you, that you can show the good behavior in the society. Also we can apply deinstitutionalization. What is the deinstitutionalization? We can say that the discharge of large number of patients from long-term institutional care. Deinstitutionalization means you can say simply goodbye to institution, goodbye to hospital, or the after the recovery, after the recovery, these patients called deinstitutionalization. Next is community mental health care center. The clear with the name, the center about the mental health. Community mental health care center are the center about the mental health and the or for the better mental health. These institutions. Aftercare is the clear. Aftercare means to care or the care of a patient. Next is day center. Day center program mean in the day setting we will change the behavior of a schizophrenic or other disorders. Halfway house. Halfway house is the clear with the name. Halfway house are residents of people with schizophrenia or other severe problem of often stopped by paraprofessional, also known as group home or the crisis house. Group home are the all patients of schizophrenic at the daytime. We can say halfway house. In the house, if totally patients are schizophrenic, that we call the halfway house. Next is shelter workshop. We will do the shelter workshop to the patients for the shelter, how you can survive in the how we can survive the management, how you can survive in the society, in the pupil, or in the social setting, and so on. Next is case manager, a community therapy. A community therapy that who offer a full range of service for people with schizophrenia or other severe disorder, including therapy, provide medication, guidance, protection, patient rights, and so on. Case manager, how we can manage the case, how we can manage the patient, how we can treat the patient of schizophrenic. That will call the case manager. So these were the techniques we can apply for the better management of the schizophrenia. If we will give these techniques, we can say that I hope our patient will be recovered, and after the recovery we discharge our patient. So our topic is closed today. What are the treatments of the schizophrenia? So I think you understand about the treatment of the schizophrenia. Next chapter, inshallah, we will discuss about the percent disorders. So take care. Goodbye. Allah Hafiz.